Hello, my name is Shelley Sanderson, and along with my colleagues Michelle Salazar and Sabrina Walker, we would like to present to you a values and communication scenario that you, as a nurse, could one day face. As you may know, nursing can be very challenging and fulfilling, and some of your biggest challenges are going to be based around your patient's values and beliefs. As the role of a nurse, you will apply your therapeutic communication skills to honor your patient's values and beliefs, although you may not always agree. Here's the scenario. A female patient in her 40s has been brought into the ER with a history of uterine fibroids. She has been experiencing excessive bleeding and dizziness for the past week and is also displaying symptoms of cold hands and feet, shortness of breath, while feeling weak and fatigued. Clearly, the patient's condition is unstable. The physician has ordered CBC lab work, a typing screen, 2 liters of oxygen through a nasal cannula, and a standard order of blood products to be administered based on the lab results in order to help stabilize the patient. The lab results come back. The patient's iron level is dangerously low and is in urgent need of a blood transfusion. You now have blood products and now have to obtain consent from the patient. As you enter the patient's room, the patient begins to display signs of anxiety and now has told you that she no longer wants the blood transfusion. Therefore, she no longer consents. The value issue represented here is respecting and validating the patient's beliefs and fears. In this case, the refusal of the blood products has now become an issue. Even though as a nurse, you know that the blood products are safe, as well as the medical importance of the patient receiving them. As future nurses, Michelle, Sabrina, and I have discussed our value topics and have concluded and agreed that the patient's life and health takes precedence and is valued more than the patient's fears. Knowing the patient's condition, you are aware that if she doesn't follow through with this treatment, it could be detrimental for her. Communication to address this situation can be delivered one of 2 ways, therapeutically or non-therapeutically. Of course, there can be only one way that would be the best option, and that would be therapeutically. But first, let's discuss some non-therapeutic approaches. You don't want to give personal opinions, such as, if I were you, I would get the transfusion so you don't die. No, you don't want to do that. You don't want to argue with the patient asking questions like, how can you not want the blood transfusions? Do you not want to live? And you don't want to give passive or aggressive responses such as, you're going to die without this transfusion, and it will be all your fault. No, you don't want to do any of those. Imagine if you were the patient and you had to deal with these responses and you were facing the same fears. Would you want to follow through with something that you're afraid of? I don't think so. Now, here's some appropriate ways to provide therapeutic communication. You can ask relevant questions. For example, ask the patient open-ended questions, such as, how are you feeling at this moment? Or, what fears do you have? It is also important to keep in mind that you are sitting facing the patient in an open position, keeping your arms and legs uncrossed while leaning toward the patient, remaining eye contact, actively listening, to what the patient is not only verbally saying, but also non-verbally saying. I know that seems like a lot to remember when providing therapeutic communication, but it's important to apply, and it's important to be relaxed while doing this. I would encourage you to practice doing this to yourself in front of a mirror so that when the opportunity like this arises, or any opportunity arises to deliver therapeutic communication, you will be prepared. And lastly, it is important to provide relevant information that the patient needs to know about the transfusion. And be sure to answer all of the questions that the patient asks. During your therapeutic communication session, you will have the opportunity to explain to the patient how blood products would benefit her. Basically, how blood products could save her life. You can explain how the blood products are safe. For example, explain the process, how the blood is screened, and it is required to match the patient's blood type to avoid incompatibility. You can also provide a visual using a pen and paper, or even a small whiteboard, of how the blood products replace lost cellular components. Explain what red blood count is, the blood clotting factors and its important role, as well as the role of platelets and albumin. Finally, you can explain how important it is for our bodies to have a certain amount of blood, and this blood transfusion will replace the blood volume that the patient has lost. Now, one appropriate nursing diagnosis for this patient would be anxiety related to threat to current status, as evidenced by once patient saw blood products, her abrupt refusal and verbalizing a fear of contracting a disease from the blood products. The patient has feelings of apprehension caused by anticipation of danger. Patients with this diagnosis may have the following characteristics: fidgeting, poor eye contact, increase in perspiration, facial tension, trembling, increased heart rate, alteration in respiratory pattern, just to name a few. One appropriate SMART goal for this patient is the patient will identify 2 symptoms of her anxiety and 2 techniques to control anxiety, as well as demonstrate those techniques within the next 12 hours. Finally, one nursing intervention to consider is using empathy to encourage the patient to interpret the anxiety symptoms as normal. Nursing is much more than passing medications and dressing wounds. Perhaps the most effective and important part of nursing is providing psychological and social support to patients, providing the patient with reassurance that her feelings are accepted and valued. Removing any form of judgment will allow the patient to freely express her feelings and reduce symptoms of anxiety. We hope that you enjoyed this video and found it helpful. And most of all, we wish you all the best in your future nursing careers. Thank you.